Hi, my name is Guy Gross. Today I'm going to be talking to you about venous thromboembolism, prophylaxis, and prevention. According to the International Society on Thrombosis and Hemostasis from 2016, up to 60% of venous thromboembolisms occurred during or after hospitalization. To make the statistic more visual for you, venous thromboembolism's occurrence kills more people than AIDS, breast cancer, prostate cancer, and motor vehicle accidents combined. In the United States, venous thromboembolism costs reach $15.5 billion annually, creating quite a significant economic burden. Research suggests that most of all blood clots occurred during or after a stay in the hospital related to comorbidities and lack of knowledge on behalf of the patient and healthcare providers regarding prevention of venous thromboembolisms. Risk assessments and prevention measures can decrease the incidence of venous thromboembolisms during and after hospitalization. Venous thromboembolisms include deep vein thrombosis, or DVTs, and pulmonary emboli, PEs. Identifying those at risk for a venous thromboembolism is pertinent in decreasing the incidence of a DVT or PE. Some risk factors include an age greater than 40, people who currently smoke, immobility, obesity, hormonal therapy, non-compliance of prescribed medications, and many disease processes such as cancer, cardiac disease, respiratory insufficiencies, etc. This information was provided from the University of Michigan Health System in 2013. Even patients who are in great health can be at risk for a VTE. Patients who have surgery, women during and after pregnancies, and those who experience significant injury or trauma can be at risk for a VTE. This information was provided from the Basildon University Hospital back in 2013. Also, competent healthcare providers are needed to identify when there is a VTE, and patients need the education to know when they may be having an episode of a DVT or PE event and when to seek medical attention, of course. Healthcare providers and patients need to know the signs of a VTE to identify these events for safety and positive outcomes for our patients. Deep vein thrombosis may cause no symptoms at all, or it may present with pain, redness, swelling in the leg. A PE might present itself with pink, frothy tinged sputum coming up from your mouth, chest pain, shortness of breath, rapid breathing, rapid heart rate, lightheadedness. As you can see, a DVT occurs in your lower extremities, and a PE occurs right up here in your lungs. Warning signs of your DVT, of course, need to be recognized by your healthcare providers and by your patients to have a positive outcome, as well as a PE. Extended bed rest is a big one when you're in the hospital. You need to be out of bed, being active, walking, in order to prevent these events from occurring. Prevention, of course, is key. Venous thromboembolism prophylaxis is the answer to preventing blood clots from occurring during and after a hospitalization. There are many different independent activities that individuals can perform to prevent blood clots from forming. They just don't know about them. We need to educate. The most helpful way one can prevent a blood clot from occurring is by walking. This is according to the University of Michigan Health System back in 2013. Walking promotes blood flow throughout the body, therefore preventing blood from clotting and pooling during immobilization and during a hospitalization. Other measures that can be taken to prevent blood clots during and after a hospitalization are exercising while you are in bed. It's very easy. All you have to do is point your toes toward the bottom of the bed and then up towards your face. Repeat this 10 times an hour, or as much as one can tolerate. This was provided by the University of Michigan Health System back in 2013. Also, being out of bed as much as possible. If you're not independent, ask for assistance with ambulation to promote blood flow and prevent clots from forming. You have to be an advocate for your own care, so if you know that this is what you need to do, then you can get it done. There are other treatment options that are available to reduce the risk of venous thromboemboli, including mechanical devices and medicinal interventions. One might ask, why would I use it? Mechanical devices such as compression stockings, foot pumps, inflatable devices such as sequential compression devices, or SCDs, improve blood flow in the lower extremities. These mechanical devices prevent the blood from pooling in your lower extremities while in the hospital or while you are immobile. This was provided by the University of Michigan Health System back in 2013. Medicinal means of prophylaxis include heparin and Lovenox. These are subcutaneous injections that are usually given and administered in the abdominal region. It is very important to educate the patient regarding the importance of compliance with these medications, as much as people do not like getting shots. They prevent the blood from clotting and need to be taken as regularly scheduled to remain therapeutic to the patient. This was provided by the NHS Confederation back in 2009. Providing educational interventions for your patients is also very important. Some individuals learn most effectively when they have materials to use and visualize what is going on, versus trying to understand what a healthcare provider is explaining to you. Sometimes a physician is very hard to understand. Their educational level is so high, we need to kind of bring things down to their level so that they can really gauge and understand what is going on. Patients are also very overwhelmed during hospitalization, which really causes their attention span to not be as great. Providing materials to utilize is an effective way to educate the patient and decrease the risk of VTE occurrence and VTE recurrence for those who have already had a VTE episode. 1/3, about 33% of people with DVT and PE will have a recurrence within 10 years. And this statistic was provided by the CDC in 2015. We really need to do what it takes to decrease that statistic and prevent it from rising. In conclusion, research suggests that most of all blood clots occur during or after a stay in the hospital, related to comorbidities and lack of knowledge on behalf of the patient and healthcare providers regarding the prevention of venous thromboemboli. Risk assessments must be done to assure that patients are getting the prophylaxis needed to prevent clots from forming. Prevention and education is needed to raise awareness of blood clot prevention. Healthcare workers and patients need to know about the interventions that are available to implement during and after hospitalization to protect the patient from a DVT and a PE. Healthcare providers have the tools that they need to prevent blood clots from occurring during and after a hospitalization. Having the knowledge to assess a patient and know what comorbidities contribute to the increased likelihood of that patient developing blood clots during and after a hospitalization is very important. By providing the proper tools, whether it be mechanical devices or medicinal means, the patient should always have a VTE prophylaxis during their stay in the hospital, and the education must be provided to them that is required to understand what a blood clot is and what the interventions are that will prevent their occurrence while they're in the hospital and after discharge from the hospital. Compliance is key. Thank you for your time, and you have a good day.